Hi, this is Dr. Carl Kolb again. This is the third webinar in a series of 3 webinars, this one about Plus 21 products. Once again, I want to emphasize, as I've done in the past, that it's necessary to read the entire standard to understand the standard. Part of the introductory phone call will be a discussion about how far along you are in compliance with the Plus 21 standard, and if there's any particular documents that allow you to self-attest at this point, and to look at that and the evidence regarding its validity and verification. The first topic you'll see in the Plus 21 standard concerns labeling. And the labeling requirement for the Plus 21 products is very robust. There is an existing program in the ASTM standard, which needs to be read. That standard is very close to the USDA standard. You follow the USDA standard, you'd be very much in line with the ASTM standard, although it bears reading that standard for clarification. As I said earlier, the labeling piece will be reviewed by us very carefully, not to submit any labeling without the particular logo, in this case, the Plus 21 logo. Annually, that will be renewed to ensure that the products have remained the same. The labeling hasn't changed, and any new labeling is brought under review for approval. The ASTM is a third-party nonprofit organization, and they've worked very closely with the hemp folks. So you need to take a look at their particular categories with regarding cannabis and specifications for the products containing intoxicating cannabis items. Child-resistant packaging is next. Here we're concerned, and this is a very subjective area, as what's considered to be child-resistant packaging. And as I mentioned before, it has to be difficult or designed so that children cannot use the product. And it comes under Title 16, Part 1700, which quotes special packaging, meaning packaging that is designed or constructed to be specifically difficult for children under 5 years of age to open and obtain a toxic or harmful substance within a reasonable amount of time, and obviously not difficult for an adult to use. So that could take on many forms: double packaging, pop tops, lids that don't open without squeezing, turning, some sort of thing. Some difficulty involved that a 5-year-old could not navigate their way through. Age verification to ensure that folks under the age of 21 don't use these products, that the retailer knows they cannot sell these products to under age 21. We implement appropriate and true age verification protocols, procedures, or recommendations such to go forward for the sale of these. All that information is necessary under certification. Some way to demonstrate that the age is a verification item and how it is verified. Cannabinoids allowed. In the standard, it talks about the Delta 9, Delta 8 particular products and THC levels or novel cannabinoids that may be used in your product, how those are validated, verified from time to time. This is where the 17025 labs come into play, where they'll test the product, tell you the concentrations by volume or by percent. Purity standards, the Delta 9, Delta 8, some of those are made from conversion process. The program will need need to know that these conversions are performed according to very high standards. And in terms of THC from conversions, must meet or exceed 95%, not 95% of the total cannabinoid. All right. A lot said there to this point. Here's where we look for the specific evidence from a lab, compare it with your formulations, and then, of course, verifying on site that that whole process is calibrated to reach the same consistency time after time. Good manufacturing practices involve all the prerequisite programs that you find in food safety to do with manufacturing, packaging, labeling, holding, distribution of the drug, dietary supplements, foods, and cosmetics. They're all specified in various CFRs that are noted in the particular standard. Third-party testing, we want to make sure that these are ISO accredited laboratories. I'm going to want to see the entire certificate of analysis provided by the laboratory. Those are the particular things I'm looking for. When your product is approved, it will be approved by letter, by specific product with pictures of the labels that have been approved. We don't want any misunderstandings or assumptions made once these approvals are granted. Also, another point to bring forward that both the program standard 4.0 and the plus 21 standard are used together. One cannot stand alone unless you don't want to approve this plus 21 products. I hope this clears things up. Please read the standard, the adult use standard, as it is detailed. It's very robust. It gets into a number of specifics. During our input phone call, I'll ask you a lot of questions to see if these can be answered with some sort of on-site or paper verification. Thank you very much.